I want to ask you something personal. Have you ever been unwell, really unwell, and had to explain how you felt to a doctor? In your own language, that is already not easy. You are tired. You are worried. You are trying to find the right words for something that is happening inside your body. Now imagine doing that in English. Not just describing symptoms, but understanding the doctor's questions, answering correctly, asking about medication, understanding the prescription, knowing your rights as a patient. This is one of the most important English situations in your entire life abroad, because your health is not something you can afford to miscommunicate. And yet, it is one of the situations most English courses completely ignore. Not today. Today, Lily is not feeling well. She has been in London for 2 months. She woke up this morning with a fever, a sore throat, and that heavy feeling that tells you something is wrong. She calls her GP. She goes to the appointment. She describes her symptoms clearly. She asks the right questions. She understands every word the doctor says. And tonight she rests with the right medication, knowing exactly what to do next. That is what English can do for you. Not just open doors, keep you safe. Welcome back to Talking Abroad. I am Nova. This is episode 5. Doctor Appointment Abroad. This one matters. Hello and welcome back. I am so glad you are here today. This is Talking Abroad. Real English for real life. The English you need when it counts. Not just at the office, not just at the airport, but in the moments when you are vulnerable, when you are scared, when you need to be understood clearly and completely. My name is Nova, and today we are with Lily, 2 months into her life in London. Everything has been going well. She loves her work. She has found her rhythm. She has a sort code and a direct debit and a very strong opinion about the tube at rush hour. But this morning, she does not feel well. Her throat is sore. She has a temperature. She feels exhausted in a way that sleep alone will not fix. She calls her GP surgery, that is what a doctor's practice is called in the UK, and books an appointment. 2 hours later, she is sitting in the waiting room. Today we follow 2 conversations. First, Lily calling to book the appointment. Second, the full consultation with her doctor. 2 conversations, 10 essential vocabulary words, 1 mindset moment about something Lily has to do in that appointment that many of us find very difficult, and our full shadowing and sleep learning section. Here is the plan. Section 1, booking the appointment by phone. Section 2, the full doctor's consultation. Section 3, vocabulary deep dive. Section 4, listen and answer drill. Section 5, mindset moment. Section 6, shadowing. Section 7, sleep learning. Ready? Lily is picking up the phone right now. Listen carefully. It is 8:30 in the morning. Lily calls her GP surgery to book an appointment. Just listen. Feel the conversation. We will go deeper together after.
Good morning, Hammersmith Road Surgery. How can I help you?
Good morning. My name is Lily. I am a registered patient at this surgery. I need to book an appointment to see a doctor today, if possible. I am not feeling well.
I am sorry to hear that. Can I take your date of birth to bring up your records?
Of course. It is the 14th of March, 1992.
Thank you, Lily. And can you tell me briefly what the problem is so I can make sure you see the right person?
Yes, I have had a sore throat for 2 days, a fever since last night, and I feel very fatigued. I am a little concerned it might be more than just a common cold.
I understand. We do have an appointment available this morning at 10:45 with Dr. Patel. Would that work for you?
Yes, that would be perfect. Thank you.
Wonderful. When you arrive, please check in at the front desk. Bring a list of any medications you are currently taking if you have one. And if your symptoms worsen significantly before the appointment, difficulty breathing, chest pain, very high fever, please call us back or go directly to A&E.
I understand. Thank you for the advice.
Of course. We will see you at 10:45. Take care.
Thank you. Goodbye.
It is 10:45. Lily is called in. Dr. Patel, a calm woman in her 50s, gestures to the chair beside her desk. Lily, come in, please. Sit down. So, tell me what has been going on.
Thank you, doctor. I have had a sore throat for about 2 days now. It started mildly, but it has gotten progressively worse. Last night I developed a fever. I checked, and it was 38.4 degrees. And I have been feeling very fatigued, more than usual. Even after sleeping, I feel exhausted.
I see. Any cough? Runny nose? Headache?
A mild headache, yes. No cough. My nose is slightly congested, but not significantly.
Any difficulty swallowing?
Yes, actually, swallowing is quite painful at the moment.
And have you been in contact with anyone who has been unwell recently?
A colleague at work was off sick last week, I believe with tonsillitis. I did not think much of it at the time.
That is helpful to know. Let me take a look. If you could open your mouth wide for me and say, ah.
Ah.
Thank you. And I am just going to check your glands here. You may feel a little pressure. Does that hurt?
Yes, a little tender on the right side.
Right. And let me just take your temperature quickly. Yes, 38.6. A little higher than last night.
Is that concerning?
At this level, it is not an emergency, but it does need attention. Based on what I can see, your throat is quite inflamed, and I can see some white patches on your tonsils, which suggests this may be a bacterial infection, most likely strep throat or tonsillitis. I would like to prescribe you a course of antibiotics.
I see. And if it is bacterial, does that mean it will not resolve on its own without antibiotics?
Correct. Bacterial infections generally do not clear up without antibiotic treatment. If left untreated, they can worsen and occasionally lead to complications. So it is important you complete the full course, even if you start feeling better after a few days.
I understand. How long is the course?
10 days. Take 1 tablet twice a day, morning and evening, with food if possible. Do not skip doses and do not stop early, even if you feel better. Stopping early can allow the bacteria to come back stronger.
Is there anything I should avoid while taking antibiotics? I occasionally have a glass of wine in the evenings. Is that all right?
With this particular antibiotic, I would recommend avoiding alcohol during the course. It can reduce the effectiveness and may cause nausea.
Understood. I will avoid it completely.
In terms of managing your symptoms in the meantime, paracetamol or ibuprofen for the fever and the pain, plenty of fluids, rest as much as you can. Cold drinks and ice lollies can actually help soothe the throat.
That is good to know. And if things do not improve or get worse, what should I do?
If you have not improved within 48 hours of starting the antibiotics, or if your fever goes above 39.5, or if you develop difficulty breathing, come back in immediately or go to A&E. Do not wait.
I will. Thank you, doctor. One last thing. Is this contagious? Should I be avoiding people at work?
Yes, strep throat is contagious. I would recommend staying home for at least 24 to 48 hours after starting the antibiotics, by which point you should no longer be contagious. After that, you can return to work.
That is very clear. Thank you so much, Dr. Patel. I feel much better knowing what is happening.
That is what we are here for. I will send the prescription to your pharmacy electronically. It should be ready within the hour. Take care of yourself, Lily.
I will. Thank you.
She walked out knowing exactly what was wrong, exactly what to take, exactly when to come back, exactly when to rest. That is what clear English does in a doctor's appointment. It does not just help you communicate, it keeps you safe. 10 words today. Every single one of them you will use when speaking about health, symptoms, and medical care in English. I hope you never need them urgently, but I want to make sure you have them. Word 1, symptoms. 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 Symptoms are the signs that tell you and your doctor that something is wrong with your body. A fever is a symptom. A sore throat is a symptom. Fatigue is a symptom. When you go to the doctor, the first thing they ask about is your symptoms. Example 1. She described her symptoms clearly: sore throat, fever, and fatigue. Example 2. If your symptoms worsen, contact your doctor immediately. Example 3. The symptoms appeared suddenly, overnight. Say it with me. Symptoms, symptoms, symptoms. Word 2, fatigue. Fatigue. F-A-T-I-G-U-E. Fatigue. Fatigue means extreme tiredness, not just feeling sleepy, but a deep exhaustion that rest alone does not always fix. It is more formal and more specific than just saying tired. Doctors use this word. You should use it too. Example 1. She was experiencing severe fatigue, sleeping 10 hours but still exhausted. Example 2. Fatigue is a common symptom of many conditions. Example 3. I have been feeling fatigue for several days now, more than just tiredness. Say it with me. Fatigue, fatigue, fatigue. Word 3, progressively. 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 Progressively means gradually, step by step, getting worse or better over time. When Lily said her symptoms had gotten progressively worse, she was telling the doctor this was not sudden. It had been building. This word is incredibly useful in medical settings because it helps the doctor understand the timeline of your condition. Example 1. The pain has been progressively worse over the past 3 days. Example 2. With rest and medication, she progressively improved. Example 3. His hearing had been progressively declining for months. Say it with me. Progressively. 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 Word 4, inflamed. Inflamed. I-N-F-L-A-M-E-D. Inflamed. Inflamed means swollen, red, and irritated, usually due to infection or injury. Dr. Patel said Lily's throat was quite inflamed. This is the medical word for what you might call really swollen and sore. Example 1, the doctor could see the throat was inflamed and irritated. Example 2, the inflamed area was tender to the touch. Example 3, anti-inflammatory medication can help reduce the inflammation. Say it with me. Inflamed. 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 Word 5, prescribe. Prescribe. Prescribe Prescribe. To prescribe means for a doctor to officially recommend and authorize a medication for you. The prescription is the document, physical or electronic, that allows you to collect that medication from a pharmacy. Example 1, the doctor prescribed a 10-day course of antibiotics. Example 2, she was prescribed paracetamol and rest. Example 3, only a qualified doctor can prescribe certain medications. Say it with me. Prescribe. 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 Word 6, course. Course. C-O-U-R-S-E. Course. In medical English, a course of medication means a complete treatment program, a set number of tablets taken over a set period of time. When the doctor says complete the full course, she means take every single tablet for the full 10 days, even if you feel better. Not finishing a course of antibiotics is one of the most common and most dangerous mistakes people make. Example 1, you must complete the full course of antibiotics. Example 2, she finished the course and the infection cleared completely. Example 3, do not stop the course early even if your symptoms improve. Say it with me. Course, course, course. Word 7, contagious, contagious. C-O-N-T-A-G-I-O-U-S. Contagious. Contagious means a disease or infection that can be spread from one person to another through touch, air, or close contact. Knowing whether your condition is contagious is important, both for your own protection and for the people around you. Example 1. Strep throat is contagious. Stay home for at least 48 hours. Example 2. The virus was highly contagious and spread quickly through the office. Example 3. Once you have been on antibiotics for 24 hours, you are generally no longer contagious. Say it with me. Contagious. 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 Word 8. Complications. Complications. C-O-M-P-L-I-C-A-T-I-O-N-S. Complications. Complications are additional problems that develop because of an existing condition, things that go wrong on top of what was already wrong. The doctor mentioned that untreated bacterial infections can occasionally lead to complications. This is a word you need to understand and ask about in any serious medical conversation. Example 1. If left untreated, the infection could lead to serious complications. Example 2, the surgery went well with no complications. Example 3, she recovered fully with no lasting complications. Say it with me. Complications. 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 Word 9, congested. Congested. C-O-N-G-E-S-T-E-D. Congested. Congested means blocked, usually referring to the nose or chest. Nasal congestion means your nose is blocked. Chest congestion means your airways are blocked. This is the medical and formal word for what you might casually call stuffed up. Example 1. My nose is slightly congested, but not significantly. Example 2. The medication helped clear the chest congestion within a day. Example 3. Congestion is a very common symptom of colds and flu. Say it with me. Congested. 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 Word 10, prescription. Prescription. P-R-E-S-C-R-I-P-T-I-O-N. Prescription. A prescription is the official order from a doctor that allows you to collect medication from a pharmacy. In the UK, prescriptions are often sent electronically to your nominated pharmacy. You need a prescription for certain medications. You cannot simply buy them over the counter. Example 1, the doctor sent the prescription to the pharmacy electronically. Example 2, she collected her prescription from the chemist on the corner. Example 3, some medications require a prescription, others are available over the counter. Say it with me. Prescription. 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 10 words. The vocabulary of someone who can walk into any doctor's appointment anywhere in the world and communicate clearly. That is not just English, that is safety. Your turn. Out loud. Every answer. Let us go. Question 1. Why did Lily call her GP surgery? The answer, she had been experiencing a sore throat for 2 days, a fever since the previous night, and significant fatigue. She was concerned it might be more than a common cold and wanted to see a doctor. Question 2. What advice did the receptionist give Lily before the appointment? The answer, she told Lily to bring a list of any medications she was currently taking. She also told her that if her symptoms worsened significantly, difficulty breathing, chest pain, very high fever, she should call back or go directly to A&E. Question 3. How did Lily describe her symptoms to the doctor? The answer, she said she had a sore throat for 2 days that had gotten progressively worse. She had a fever of 38.4 degrees since the previous night. She felt very fatigued even after sleeping. She also had a mild headache, slight nasal congestion, and painful swallowing. Question 4. What does progressively mean? Use it in a sentence about your own life. The answer, progressively means gradually getting worse or better over time. Your sentence might be, my English has been progressively improving since I started watching Talking Abroad. Any version is correct. Question 5. What did Dr. Patel diagnose and what did she prescribe? The answer, she diagnosed a bacterial infection, most likely strep throat or tonsillitis, based on the inflamed throat and white patches on Lily's tonsils. She prescribed a 10-day course of antibiotics, 1 tablet twice a day, morning and evening, with food. Question 6. Why is it important to complete the full course of antibiotics? The answer, because stopping early, even if you feel better, can allow the bacteria to come back stronger. The full course ensures the infection is completely eliminated. Question 7. What does contagious mean? What did the doctor tell Lily about going back to work? The answer, contagious means a condition that can be spread from one person to another. Dr. Patel told Lily that strep throat is contagious, and she should stay home for at least 24 to 48 hours after starting the antibiotics, by which point she would generally no longer be contagious. Question 8. What symptom did Lily say was tender, and on which side? The answer, when the doctor checked her glands, Lily said it was tender on the right side. Question 9. What did Dr. Patel say Lily should do if things did not improve? The answer, if she had not improved within 48 hours of starting the antibiotics, or if her fever went above 39.5, or if she developed difficulty breathing, she should come back immediately or go to A&E. Do not wait. Question 10. What does prescription mean? How did Dr. Patel send Lily's prescription? The answer, a prescription is the official order from a doctor that allows you to collect medication from a pharmacy. Dr. Patel sent it to the pharmacy electronically, meaning Lily could collect it within the hour without any paper document. Question 11. Lily asked the doctor if her condition was contagious and what she should do about work. Why was this a smart question to ask? Because knowing whether you are contagious protects both you and the people around you. It also shows the doctor you are thinking responsibly about your colleagues, not just yourself. In a professional setting, this kind of question demonstrates care and awareness. Question 12. Describe your own health in English right now, using at least 3 words from today's vocabulary. There is no wrong answer. Maybe you said, I do not have any symptoms right now. I feel no fatigue. I am not congested. Or, I had a sore throat last week that got progressively worse before I recovered. Any version is perfect. 12 questions. Everyone answered. In medical English. That is remarkable. I want to talk about something Lily did in that appointment that many of us find very, very difficult. She asked questions. Not just one question, multiple questions. She asked about the diagnosis. She asked about the medication. She asked about alcohol. She asked about returning to work. She asked about what to do if things got worse. And I want to ask you, when you are sitting in front of a doctor, a lawyer, a bank manager, any authority figure in a second language, do you ask questions? Or do you nod, say thank you, and walk out hoping you understood enough? Be honest. Most people nod and walk out because asking questions feels risky. It feels like it will reveal how much you do not know. It feels like it will take too long. It feels like the professional is too busy to be bothered. But here's what I know about Lily's appointment. Dr. Patel said, that is what we are here for. She was not bothered. She was doing her job. And Lily walked out knowing exactly what was wrong, exactly what to do, and exactly when to come back. The person who nodded and walked out, they might have stopped their antibiotics after 3 days because they felt better. They might have had a glass of wine. They might have gone back to work the next morning and infected 4 colleagues. Asking questions is not weakness. Asking questions is how you protect yourself. And in English, there are phrases that make asking questions in formal situations feel completely natural and professional. Could you explain that a little more? Just to make sure I have understood correctly, is there anything I should be aware of that I have not thought to ask? That last one. Is there anything I should be aware of that I have not thought to ask? Is one of the most powerful questions you can ever ask a doctor, a lawyer, or anyone whose expertise you are relying on. It shows you are serious. It shows you trust them. It often prompts them to tell you something important that you would never have known to ask. Say this with me, out loud. I ask because I care about understanding. Asking is how I stay safe. Say it again. I ask because I care about understanding. Asking is how I stay safe. Now, next time you are in that room, that office, that appointment, ask. Repeat after me. Rhythm. Precision. These sentences could one day be the most important sentences you ever say in English. Good morning. My name is Lily. I need to book an appointment today if possible. I have had a sore throat for 2 days, a fever since last night, and I feel very fatigued. I am a little concerned it might be more than just a common cold. It started mildly, but it has gotten progressively worse. Swallowing is quite painful at the moment. A colleague at work was off sick last week, I believe with tonsillitis. Yes, a little tender on the right side. If it is bacterial, does that mean it will not resolve on its own without antibiotics? How long is the course? Is there anything I should avoid while taking antibiotics? I will avoid it completely. And if things do not improve or get worse, what should I do? Is this contagious? Should I be avoiding people at work? I feel much better knowing what is happening. I ask because I care about understanding. Asking is how I stay safe. Those sentences, that is health English, living in your mouth, ready when you need it. One final section. Welcome to the sleep learning section. You are safe. You are resting. Let everything else go. We are going to go through today's words gently, one by one. Symptoms. Symptoms are the signs that tell you something is wrong with your body. She described her symptoms clearly: sore throat, fever, and fatigue. Fatigue. Fatigue means extreme tiredness, deeper than just feeling sleepy. Even after sleeping, she felt significant fatigue. Progressively. Progressively means gradually getting worse or better over time. The pain has been progressively worse over the past 3 days. Inflamed. Inflamed means swollen, red, and irritated due to infection. The doctor could see the throat was quite inflamed. Prescribe. To prescribe means for a doctor to officially authorize a medication for you. The doctor prescribed a 10-day course of antibiotics. Course. A course of medication is a complete treatment program. Always complete the full course, even if you feel better. Contagious. Contagious means a condition that can spread from person to person. Stay home for 48 hours. You may still be contagious. Complications. Complications are additional problems that develop from an existing condition. If left untreated, the infection could lead to complications. Congested. Congested means blocked, usually the nose or chest. My nose is slightly congested, but not significantly. Prescription. A prescription is the official order that allows you to collect medication. The doctor sent the prescription to the pharmacy electronically. And now, some sentences to carry you into sleep. I have had a sore throat for 2 days. It has gotten progressively worse. I feel very fatigued, more than usual. The doctor prescribed a 10-day course of antibiotics. Complete the full course, even if you feel better. Is this contagious? Should I be avoiding people? I ask because I care about understanding. Asking is how I stay safe. 5 episodes. 5 hours of English practice. You can now speak in a job interview. Navigate an airport. Move into a flat. Open a bank account. And see a doctor. That is not a small thing. That is an entire life in another language. Rest now. Take care of yourself. You matter, and your health matters. Good night, and well done.